Hi, I'm Jillian Dean, and our topic of today is adjustment disorders. So, what are the key features of adjustment disorder? There are 5 criteria that must be met when diagnosing adjustment disorder, and they are behavior or emotional symptoms that occur in response to the stressor that can be identified. Dr. Grande in his video states that the second criteria is that it must cause clinically significant symptoms that cause distress, or that could be defined as out of proportion to the severity or intensity of the stressor, taking into account the cultural factors and the external context or of significant impairment. The third criteria is that this disturbance does not meet the criteria for another diagnosis or condition. The fourth criteria is that this behavior is not showing signs of normal grief or loss. And the fifth criteria that Dr. Grande suggests that the behavior indicates that if the stressor terminates, that we shouldn't see symptoms lasting for more than 6 months. Adjustment disorder has 6 specifiers: depressed mood, anxiety, mixed anxiety and depressed mood, disturbance of conduct, mixed disturbance of emotions and conduct, and unspecified. Coping with any change is hard, but when the same stressor is reoccurring, it can also make the person feel like they can never get away or climb out of the state they are in. The next question that was asked was, from a diagnostic feature perspective, what constitutes having a diagnosis of adjustment disorder versus or more than any of the other trauma stressor related disorders? Johns Hopkins site states that an adjustment disorder is an emotional or a behavioral reaction to a stressful event or a change in a person's life. The reaction is considered an unhealthy or an excessive response to the event or a change within 3 months of the event happening. Stressful events or changes in the life of your child or adolescent may be could be considered as a death, a move, a divorce, separation, a change in the environment, such as the birth of a new sibling or the loss of a sibling. Another reaction could be a diagnosis or a chronic illness that changes the environment or their routines. The difference in adjustment disorder is that the symptoms can last up to 6 months, and the stressor is usually like a season or event that took place, differentiating from like a traumatic event. While the therapist can give tools for grief in both adjustment disorder and trauma stressor related disorders, grief is not always traumatic, but trauma always has a pattern of grief, and the responses to that are clear indicators between the two disorders. The Johns Hopkins site states that adults can experience adjustment disorder, but it is usually or predominantly diagnosed in adolescents or children. So, the final question is, why is it essential to have specifiers and modifiers present in listing any of these diagnoses? 1, it's important so we can diagnose these disorders properly within the right disorder and being able to understand the right treatment plan or severity of the disorder. The DSM-5 states that there is several levels of specifying if it is acute, persistent, with a depressed mood, with anxiety, or mixed with anxiety and a depressed mood, with a disturbance or of conduct, or with mixed disturbance of emotions and conduct. With other specified grief or unspecified trauma or prolonged grief disorder. This allows the therapist to diagnose to the specifications so that they can move forward in another diagnosis, or they can move forward with a treatment plan with these specifiers and modifiers. That's all I have for today. Thank you so much and have a great day.